Welcome to Health News. We do this usually every 1 to 2 months, and we're delighted tonight to be able to feature the theme of maternal health. We're delighted to have everyone with us, and our guest speaker tonight is Medina Lamunu from Gippsland in Victoria.
Thank you so much for joining. My name is Medina Lamunu. As Michael has introduced me, I'm a registered nurse and midwife, and most of you have heard about my story. I was born in South Sudan, grew up in a refugee camp, and came to Australia in 2006. And I got 6 children, and my husband George at the moment is in South Sudan doing the project. So in 2011, I had the urge that I should do midwifery and nursing because of the history that, story that I had from South Sudan. There was high rate of maternal mortality and infant mortality as well. As you just heard from Owen, most children don't celebrate their 5th birthdays, and a lot of mothers, they don't survive pregnancy. And it's not like here when people find out they're pregnant, they celebrate. In my village, especially where I came from, people, when they find out they're pregnant, they feel like they're having death sentence because they never know whether they will make it alive or not. So when I decided to do my midwifery and nursing, me and my husband, we wrote a project to start in South Sudan. And luckily within 1 week, 2 months, we went to church and met a Christian couple. You can see them on the screen here, John and Jean. So we met them. Yes, we met them, and then luckily they were also working in Africa particularly. So from there, I told them my passion and what God has put in my heart. And they supported us in that. So in 2013, we established a project for school, Anna African Action South Sudan. From there, I also enrolled in my nursing 2013. Luckily, I completed it in 2016, and then I graduated 2017 while I was doing my grad year. And after that, I went back to do my midwifery in 2018, and I had to defer in 2020. Unfortunately, COVID came as well. But in 2019, I went to Burke in South Sudan, and what I saw there, it can never be unseen. So the background of South Sudan, it sounds like basically Owen has spoken about it. As I mentioned, South Sudan has been in war for so long, 21 years. And when the war ended in 2005, and then South Sudan got independent in 2011, people started returning back from refugee camp back home. And starting life afresh, it was really a struggle. Even after now, healthcare system hasn't been established yet in South Sudan. And we all know that healthcare is health is one of the fundamental rights for everyone. We enjoy health system here, especially in Australia. We are so lucky, but the rest of the world, especially like South Sudan, they don't have that access. Just keep going. And there's so many diseases that can be cured, especially malaria. Malaria is the main killer. And I'm so lucky to have all my 5 children because my girl, I was holding her hand there. That was me in a bar. I think that was January 2020. So when we came back in February, my daughter had a severe malaria. And there's no way she could have survived if she was in my village. because he needed the IV treatment, intravenous treatment. So I'm very thankful for Australian government. So in South Sudan, because what we are planning to do is to open the medical center for maternal and child health, I communicated with the director of ministry in South Sudan for the county level. I was told there are 3 tiers in the system. So one is the primary healthcare unit, and that one, they don't admit any patient. And the second one is the primary healthcare centers and hospital, the third. Those one, they can admit patient, and they can have maternal and child health as well. So we have to go by that one, because as you can see, you will see down, there is a primary healthcare center in Obo, but they don't run 24/7 because they don't have staff. Keep going, thank you. So running medical center in South Sudan, it requires a minimum of 13 staff member and maximum of 27. That is the primary healthcare center or the hospital. And there is no fixed salary for the healthcare workers. So they get paid according to what the healthcare center decided. Just keep going, thank you. So, you know, Bob, particularly the primary healthcare center serve around 3,000 locals. And on average, the C patient is there 150. And about 40 babies get born over there. There's only one trained midwife, and 18 months training, and then 4 traditional midwife. So which means the women who had a baby, then they qualified to be the midwife. No training. And there's no gynecologist or obstetrician. Just keep going. Thank you. So that is a primary healthcare center in Obo. You just walk, there's no any other room. That's people sitting at the corridor, so waiting to see they call them the medical officer. And when I walk in past those people, there is no any blood pressure machine, no any diagnosis equipment, except for the malaria and typhoid. So, and what they say, mostly sometimes they have to check under the nail bed or under the eye to see if there's a blood flow. Otherwise, they will be diagnosed with anemic if there's not enough blood flow under the bed nails. Just keep going. That was me checking. I had to take my blood pressure machine because there was none in there. I was checking the blood pressure for one of the expectant mother in the antenatal clinic. That was in 2019, December. And that was the room for the antenatal clinic. Everyone sit there and they ask them all the questions. There's no privacy. And there was a tiny room next to it whereby they go, they check their fundal height, how big their baby has grown. But I couldn't take any photo because it was so dark in that room. I had to use my phone as a light. And there is a nutritionist checking the women as well. Yeah, that is called the bed delivery room for second stage. If a woman is in labor, they don't have anywhere to labor. They labor in the corridor. And if they started pushing, that's the bed they take them to. And that bed you see, the other one is the resuscitation for the baby. When the baby is born, they can't breathe, they take them there. And then there's a delivery bed, the woman is on it. And when she delivered the baby, they have to move her quick because if another woman wants to deliver, they have to wash it. Can you keep going, Michael? Thank you. Just keep going. And women who are delivering in that facility, they have to bring their water because there's no water source in that facility. As you can see, those 3 buckets, they contain water for this infectant for cleaning after the delivery. And that's how small the room was. You could see my legs there when I was trying to take the picture, and I was against the wall as well. And yeah, as a midwife, I work here in Australia, and I see the luxury and how lucky we are to have a big room with a shower inside, a bath inside, everything. But it's just a different world when you go to South Sudan. So this is a river. People face water for use, and yeah, they said water is life, but not all water is life. Clean water is life. I can say that. So the only solution to the above, as you have seen, the problem where I visited, is not only in Obor, but generally in South Sudan, medical center need to be built. So I've decided that Orison Medical Centre need to be built, because I name it Orison. It has been my prayer. And when I visited Obor, I've heard from so many locals. They have been, you can't meet someone in that area who doesn't know a woman who has passed away giving birth, or a child who has passed away before reaching their 5th birthday. Everyone is affected. So I think God has put what I'm doing now in my heart with a reason. Because if I can't do it, who else will do it? And I have a privilege to be in Australia here. I'm supported by so many people who love God, who serve as Jesus would do. If Jesus is to come today, I'm sure Jesus will go around the world treating people like as he did previously. So our vision is to provide accessible quality health care. Thank you. You can keep going. I think we're running out of time. So the Orison Medical Centre will consist of maternity unit, maternal child health, outpatient and inpatient department, and immunization program as well. So first step would be drilling of the borehole. At the moment, we are raising funds for drilling the borehole. So about approximate cost is about 10,500 Australian dollar, but this estimation was like last year, could be more because the exchange rate of Australian has gone down. And the next thing would be building the medical center. Bricklaying is ongoing, and we have the drawing for the medical center as well, as you can see over there. Drawing. Keep going, Michael. It's nearly there, nearly finished. I think 2 or 3 more slides. How you can get involved. You can contact me if you need any more information, or you can ask questions later. Spread the news, spread the word, face-to-face or via social media. Make donation. Every $2 count, so it's tax deductible, provided by HealthServe Australia. And conduct fundraising anyway. Invite me to speak to any gathering. I will do that. Hopefully, my PowerPoint will work well. And come volunteer in medical center in the future. So like African Action South Sudan Facebook, or HealthServe Australia Facebook for updates. And I put that one there. I don't know if any of you noticed at the beginning, I put 1 Corinthians 13:13. Because all the time people ask me, how do you do this? And you got children, you need to raise them, and then you're working, you've been studying. How do you do it? I always said, God keep me doing it. And I picked these 3, this Bible verses, 3 things will last forever: faith, hope, and love. And I've made, this design for my cap. I have it at workplace. So it has faith, hope, love, and forgiveness. That's how I survive my cup of tea every morning. And that really helped me, because without faith, I can't do what I'm doing. And without hope, no way. And love is the love I have for the people and for everyone and for myself too. And forgiveness, there's no way I will do what I'm doing if I don't forgive my childhood, because I didn't have a good childhood. And I could keep on blaming what happened in the past, like why. And even now, the government of South Sudan, why they're not doing much, like, but forgiveness helped me do what I do. So together we can improve the healthcare where it's lacking. And as we all know, health is paramount. Thank you, God bless. If you have questions, you can ask. Thank you.